everybody, Dr. Greg Persley here with PC Medical Centers in Cape Girardeau, Missouri. One of the big questions we get here in the office is, how does this process happen? See, most people think this is an aging process, meaning as you get older, this happens, arthritis or degenerative arthritis. But I want to explain a few things about that because this is more than just an aging process. So there's actually three factors. Time, which is one, most people think of that as age. But here's something to think about. You have over 300 joints in your body. Have all the joints been in your body the same amount of time? Absolutely. They've all been in there the same amount of time. So if this was strictly an aging process, then the older you got, all the joints would age at the same rate. But it's not just aging or time. That's another way to say age. It's also function. What do I mean by that? What I mean by function is, if this joint stops functioning properly, over time, it will move down this scale. So that's how an aging issue will happen. People think, oh, it's age, but it's actually function and age. The third factor, though, is the wild card. And the third factor is pressure or usage. So if this isn't functioning very well, and you use it a lot or put a lot of pressure on it, then it takes less time to degenerate. See, we see patients all the time that have a low back x-ray or a neck x-ray or even one of their two knees. And one of them will look fantastic. The next one will look terrible. So if it's an aging process, they should both look terrible, right? Well, if one of them's working correctly and the other one isn't, the one that's not working correctly is the one that's gonna break down first. So it's kind of like a car tire that is out of balance. If it's out of balance, it will wear away unevenly. The more you drive it and the faster you go, the quicker the out of balance will cause damage. And that's exactly what happens to your joints. So if you have one knee that's hurting and the other knee feels okay, come in and get this knee checked out, because guess what? If this knee starts hurting and the other one feels okay now, eventually the other one will start to hurt because you're going to be using it improperly, which is a functional problem, and it will cause damage over time. It's better to prevent than to try to catch up on the back end and get treatment. An ounce of prevention is worth a pound of relief. Really great saying. So I'm Dr. Greg Persley at PC Medical Centers, and if you think you have any of this degeneration or arthritis going on in your body, in your knees, your hips, your low back, your mid back, your neck, your shoulders, or any other joint, give us a call. It's probable that we'll be able to help you out to get you back to doing things that you weren't able to do because the pain was keeping you from doing them. Look forward to seeing you soon. Dr. Greg Persley, PC Medical Centers, Cape Girardeau, Missouri. Click the link for a free consultation.